Hi guys, good morning. Dr. Rehman here. So I'm going to talk about the osteoarthritis of the hip joint. Osteoarthritis of the hip is wearing out of the cartilage and then the bone starts to break down. So the ball and socket hip joint starts to become arthritic. CAM deformity, CAM, is a critical thing that leads to osteoarthritis of the hip. Of course, what we do, how much we do, our weight and the muscle tightness, all of these determine how the hip becomes arthritic. So what do you do for a hip that becomes arthritic? Well, first thing is ibuprofen, Aleve, Advil, and most important thing is good stretching of the muscles around the hip joint. This is why we're not able to run very much as we get older, because the hip muscles become so tight that it's difficult to keep running and stretching, taking long strides. So that is why we become tighter and tighter and the joint breaks down even faster, because the muscles are tight and they're grinding out the joint. So ibuprofen, Aleve, Advils, stretches with therapy, steroid injections. Hyaluronic acid is not approved, I think, with insurance companies at this time for hip joint injections. Beyond that, you can go to series of platelet-rich plasma injections. You can use bone marrow, mesenchymal stem cells. You can use lipoaspirate fat-derived stem cells or fat-derived cellular mix you can inject in there. And you can also inject the birth tissues after proper consenting, etc. Everything needs proper consenting. So birth tissues such as amniotic allograft or umbilical cord, Wharton's jellies, growth factor matrix, you can inject those. So these things are extremely effective for hip joint. Not as much as knee or other joints, but still very effective, and they can be life-changing. So take care, and I'll talk about each of these things in a detailed video later. Have a good day.